I would love to introduce Busayo. She is one of our board certified women's health nurse practitioners. She is a specialist in menopause, but it also has been working very closely with our weight management program to improve it and really help us through a lot of these transitions as the FDA has really made things interesting for us, right? With lots of shifts and changes. But ultimately, I think what we've done is create programs that are really more tailored to each different patient and can meet them a little bit more closely to their specific needs. So, um, I'd love for you, Busayo, to kind of introduce us. Maybe I can ask the question like, what is
Mhm.
medical weight management and how does it work? Who is it for?
Yeah. One of the ways I like to think about weight management is that it's something that historically has been like, it's been scary for people. It's only the super obese people that are on it. But one of the things I've really loved with the movement, with the GLP-1s, is that a lot more people are eligible and are finding answers and solutions. So it is a provider-based program. It is evidence-based. And basically, we provide you a medication, whether through injectable form or oral, to help you with appetite suppression as well as insulin management, because that's all going to contribute to helping you lose weight, as well as not taking in so much food and being more mindful and intentional about what you put into your body, because I know that can be really, really hard, especially as women, as we age. A lot of things can happen, and it makes it really hard, no matter what we try to do, um, to lose that weight.
Yeah, some things that didn't that used to work don't necessarily work anymore, and that can be incredibly frustrating. Who are the ideal candidates for this? I know, like you just mentioned, it's kind of shifting all the time. But who is a great candidate for this, and how do we determine their candidacy?
Yeah. So for clients who really have like a significant amount to lose, like, and they have a bunch of different comorbidities, I definitely recommend going to your primary care doctor to rule that out, because there might be other things that need to be dealt with first before starting and jumping into this program. If you are someone with a BMI of 27 and you have like other comorbidities like diabetes, things like that, you're a great candidate. PCOS, so polycystic ovarian syndrome, patients with that are good option or candidates as well. And then honestly, just for anybody who feels like they might need a little bit of assistance with helping control their diet. You don't have to be someone who has to lose, excuse me, an ex significant amount of weight. It's just those are some of the things that we think about when we approve you all for candidacy for our program.
Sure. And can you talk to our guests here about what that candidacy consult looks like? What are we looking at, and how do we determine if it's safe for them?
Yeah. So one big thing is we're going to look at your medical history. There are certain people who are not good candidates for this. So if you have a family history or a personal history of thyroid cancers, it's just not really a good option for you. And if you are someone who has gastrointestinal issues like IBS or Crohn's, it's also probably not a good idea, just because this medication does have a lot of effect on the GI system. And if your GI system is already impaired, it doesn't make sense to impair it even further. So we'll go ahead and do that. And then we kind of see like, what does your lifestyle look like? Because one of the things that I like to stress with the GLP-1s and all these other medications is that it's a tool. It's not going to do all the work for you, but it helps you along the things that you're already doing. So we love to provide information about like nutritional support, different exercise things and tips that'll help. Weight-bearing exercises are obviously very beneficial to help with that process, because one of the things that can happen sometimes is there can be some muscle loss while people are on this, because some people lose weight so fast that their muscle just it's gone. So it's something worth investing and considering about.
Yeah, and I think that patients, what I find is that patients really like the accountability
Mm.
aspect of it. Coming in and talking to the providers regularly, like allows them to feel like they need to keep themselves
Mhm.
honest, and it gives them a little bit of an extra layer of accountability that I think people really benefit from.
Yeah, no, absolutely.
Can you talk to everyone about kind of where we've landed and how we've really made it more customizable and suitable for like really specific types of patients?
Absolutely. So kind of going back to that initial consultation where we just decide like, hey, what kind of plan should I be on? That is something that we deeply consider. So we kind of have some more basic medications, guess I could say, for people who don't maybe need to lose too much weight. So they just need a little bit of assistance. So that might be something like naltrexone, Wellbutrin, metformin, things like that, because you can use them for a short period of time and they can assist or jumpstart weight loss if you've been having trouble with that. Of course, there's always the standard injectable GLP-1s, but We do like to reserve that more for people who feel like they have a more significant amount of weight to lose and need a little bit more support. But there's also the oral option, which is, I think, one of my favorite things that just kind of came out recently because not everybody wants to inject themselves with a needle every week.
Everyone's
Um,
really excited about this option.
exactly, yeah. So I think it's really nice that we have that option as well. And with the oral option, it is tirzepatide. So it is, if you're familiar with Zepbound, it's very similar to that one, whereas the semaglutides, like Kelly mentioned earlier, are more closely linked to like the Ozempics and the Wegovys, things like that. Another thing that we can do as well too is that there are like injections that we can use, metabolic like vitamin support. We do have like NAD injections and things like that that can help kind of stimulate not necessarily your metabolism, but overall stimulate the way that your body processes things. So that helps with your metabolism as well. We also love to use accountability check-ins. One of the things that we really want to do is to make sure that you're successful. It's one thing to just give you a medication in whatever form it is and say, all right, here you go lose some weight. But if it's something that you can't maintain or it just doesn't feel right for you, it's not going to be something you continue with. And that's ultimately what we want you to do. We want you to start on a plan that feels like it's right for you and continue on in a way that makes sense for you for the rest of your life, ultimately.
Absolutely. Yeah, I don't, yeah, like this isn't just like an RX and like wishing you your best. There
Mhm.
really isn't a collaborative feel, I think, along with all the programs that we do with our patients. And it's so fun to see people transform from the
Yes.
beginning to, maintenance and kind of like the after. And one thing that I didn't really think about chatting about, but was a lot of people say, I don't want to be on this forever. Am I going to have to be on this
Mhm.
forever? Right? That's such a popular question. And what do you usually tell people who are wondering about that?
Yeah. So one of the things is that no, you do not have to be on it forever. Because again, like I mentioned earlier, it's a tool. It's not meant to be everything. But I know that there's a lot of interest in growing support for microdosing for people who just, again, need a little bit of support. And that is something we do offer as well. I did forget to mention that earlier, that you do have the option to microdose. So honestly, I feel like it's really how do I want to say it's a team effort. It's one of those things that you and the provider are really going to have a good conversation with what that looks like for you. For some people, it might be just a short period of 3 months just to kick things off. For other people, it might be up to a year, maybe more. So it all really depends on what you're coming in with, to be honest.
Sure. Yeah. As everything we say in at Essential, it depends, right? It really depends. So we talked briefly about like Zepbound and Ozempic and Wegovy. So these are all brand names, right, for GLP-1, which is basically a peptide that
Right.
helps do what? Can you kind of explain a little bit of what, like, how does a GLP-1 actually work?
Yeah. So GLP-1s, just for people to understand even what it stands for, because like GLP-1s, but what does it even mean? So basically, it stands for glucagon-like peptide, and basically, it is a hormone, like Kelly said, that helps your body to process your blood sugar. It keeps it a lot more stable. And so when you keep your blood sugar more stable, you don't have those increases and those spikes that cause you to want to eat more food, which again leads to weight loss. And so that's one of the ways that it's really supported for a lot of people. It also helps to regulate your insulin levels as well too. So that way, if there is any excess sugar in your blood cells, that your body is able to process it more appropriately, because that's what insulin's for. We don't want to have people who have insulin resistance, and then the insulin's not able to do its job because that really sucks. And then another thing as well too is it also kind of helps control a part of your brain that talks to you basically about appetite, which I kind of like because I do think that for some people, the food noise that they were having, I think is kind of nice because I feel like that part really does well for that. And so I know a lot of research is even showing too people with different kinds of addictions of different kinds, they're actually benefiting from GL1 support just because it's so good in that way that it works with your brain.
Which is really exciting for everybody in the future. Yeah, I feel like a lot of feedback I get is that the chatter is turned down. It may not be
Mhm.
gone all the way, but the volume is way down.
Mhm.
And so they're not constantly thinking about what next snack they're going to have or what they're going to have for dinner. And so it allows you, again, as a tool to make better choices
Mhm.
um, more consistently, right?
Yeah.
Um, so a lot of people ask about insurance for this.
Mhm.
In some cases, this is covered by insurance, and like you said, then that's really a good case for you to go to your primary care physician and talk to them about this, or a specialist who can really help you navigate that process. Um, We don't accept insurance on essential, but we do provide patients with insurance-friendly receipts and HSA or FSA receipts. So,
Yeah.
at the end of the year, if you haven't used it and you lose it, this might be a great opportunity for you to kind of see if this is a good fit for you. So that's something that we can easily provide our patients. But by bypassing the insurance piece, you're getting faster access, more personalized care, a better level of support. There are two different ways that people can get started most easily. You can book a weight management consultation and just set up a visit with one of our nurse practitioners, Supusayo or Sarah or Christina, to talk about those options. Or you can choose to have a women's health consultation. And can you touch upon maybe a little bit about like how that's different from just doing the traditional medical weight loss route and what the benefit of that might be?
Yeah, absolutely. So, kind of like what we talked about earlier with some of the qualifying conditions, someone who has PCOS is going to kind of struggle with things a little bit differently. And so, I love kind of being able to bring it back to the why this is going on, because that helps people better understand what is going on in their bodies and how best to deal with the repercussions, so the weight gain. Um, because conditions like PCOS, they do have a lot of insulin resistance as a big issue. So, if we can tackle that, it's really great. Another thing is for those who are perimenopausal or menopausal, that dip with estrogen, what we know is that it redistributes where the fat is stored in your body. And so with putting you on a GLP-1, it kind of helps support you a little bit more so that your body's able to do what it was doing before, but just a little bit better. And in that case as well, too, you can always speak to us because we're board certified nurse practitioners, and we can talk to you about other things like menopause support, weight support, if that is, or not weight support, we do talk about that too, but um, hair loss support. That's what I was going to
Hmm.
say. If that is something that you're struggling with, because again, if you're losing significant amounts of weight, that might be something that you deal with. Or if you're menopausal, that might be something too. So I kind of like the fact that we can start you with men or weight loss, but then kind of dive into whichever avenue kind of works best for you.
Yeah. And one of the things I know I'm biased because I just love what we do and I think that we do such a great job. But one of the things I am especially proud of, having seen other practices over the past couple of years roll these different programs out, is we've been very intentional about not doing things too big or too fast. And really, it's allowed patients to have a better quality experience long term. They haven't seen these massive drops like in muscle mass like you've seen. We've had really consistent, attainable weight loss that
Mhm.
hasn't really robbed them of like how they look or how they feel in terms of being well. And learning so much about how the rest of the medical field uses these medications and how we use them so differently.
Right.
I just feel like we have really locked into like getting results without making people feel miserable or dealing with these major side effects. Like, absolutely anyone can have side effects to these medications, but we've really focused on trying to minimize that as much so that you're getting the results without having to have these like more medication than you need, which is just making you feel sick.
Right.
I'm really proud of that. And Christina did an amazing job really focusing on that as she rolled things out. And then as we've continued to address things and change things and make things even more customized, the three of you have really just been really good at making sure this is something that is safe and effective, but also really kind of manageable and comfortable. So thank you for that because you guys are amazing. So like I said before, if you wanted to get started, you could go to our website. It's essentialmedspa.com and then /book now will send you to our booking page. And from there, you can choose what kind of consult you'd like. You could, if you are having additional menopause symptoms or maybe menopause symptoms and you're not quite sure, that option gives us that consult gives us the option to really focus more on like root cause. And then we can go from there in terms of your care in whatever direction we need. Or if you want to cut straight to the chase, you can go right to a medical weight loss consultation, and that will just help you say, okay, this is what I want to do. Tell me what I need to do, and then we can kind of customize it for you. We have four major programs available to patients. We have a microdosing with injectable GLP-1s. We have an oral GLP option. We have a oral non-GLP option, and then we have a injectable full dose GLP option for those who want to lose a little bit more weight. So that way, patients who only want to lose a little or really have smaller goals can do things in a much smaller capacity, and that would save them some money as well. So we've been very thoughtful in terms of how to build this so that it can be accessible to everyone. And I think we've done a pretty good job.
I think so. I agree.
Like who isn't a candidate for this?
Yeah. So someone, I would say someone who has maybe, I don't know, 50 to 75 pounds or more to lose, you might need to speak with more of like a medical specialist
Weight
within
loss.
your practice, things like that, just because there's a lot more weight that you need to do, more close monitoring that you need. Like I mentioned before, anybody who has family history or personal history of like pancreatic cancer, thyroid cancers, just because these GLP-1 medications are known to cause a little bit more thyroid cancers, unfortunately. Granted, very rare, but again, if you have something, we don't want to stimulate it at all.
Right.
And then again, like I said, people who have GI issues, because we do not want to aggravate that more, because one of the big side effects, well, I guess we could talk about side effects a little bit, but
Yeah.
one of the big side effects that people deal with a lot is the gas. So people's gastric motility is slowing down a lot. So a lot of times people can have like bowel obstructions if they aren't drinking enough water, if they're not moving. And so that can be pretty severe. So we do really like to make sure that people are aware of this and they're staying on top of that.
So I just want to say thank you for taking the time to explain this to everybody. I think that was just a really great explanation of the lay of the land of medical weight loss. We hope that gave you some clarity in terms of what your options are, and if you are ready to take that next step to book a consultation. If you are not and you have questions, reach out to us at info@essentialmedspa.com. We'd be happy to answer those questions and figure out what ways we can help you feel your best. Hope to see you soon.
Good night.
Thank you.